Good afternoon. My name is Carlos Gomez. I'm an assistant professor at McGill University, and today I will want to share with you some ideas and some conceptualizations around the influence of raters, supervisors' emotions on the judgments that they create, especially in terms of entrustment of their learners. So I was told that I need to spend 7 seconds showing this slide. I can speak in Spanish, I can read it in English, but I have no conflict of interest to declare, and those are my 7 seconds. So before moving forward, I would like to really take a couple of minutes in order to really set the stage in terms of what is considered assessment. An assessment could be conceptualized as any process in which the intention is to gather information in order to make decisions. And in addition to that, some authors have considered that the process in order to do something with that information is a reasoning process. It's somehow analyzing the information, interpreting the information, and in the case of assessment in the educational context is to make decisions about the attainment of competencies and the progression over time. So I think that it will help us also to situate this life cycle of an assessment. All assessments start as a process in which the first step is the creation of the assessment, and that entails a process in which the purpose should be stated and also to clarify the competencies and the methods to be used. Followed by the implementation of the assessment, that it's more of a process in which the format of the assessment is shared with the raters, and also in which the raters will have the opportunity to understand what are the purposes and the intentions to use this assessment tool. Followed by the generation of the assessment information, and basically the question that we are answering with this step is whether we are capturing sufficient information in order to make sound decisions about the progression of our learners, and this is the moment in which the feedback takes place, followed by making that decision that generally in the case of, especially in workplace-based assessment, relates to what are the levels of competence that their learners have. So let's imagine that this bubble represents the actual level of ability of anything. A lab colleague, driving a car, mathematics ability. And what we try to describe with this circle, it's the level of ability that it's assessed with one given assessment tool. The overlap between the two circles represents what aspect of the ability is captured by the assessment tool. But because we are not naive and we know that we need more than one assessment tool, so we create another assessment tool in order to capture hopefully another element of the actual level of ability. This leads us to the Mickey Mouse assessment, which is this notion in which we are creating assessment tools with the idea that the assessment tools are complementary and they are not related one to the other. However, in reality, what we have is assessment tools that, as I mentioned, capture a specific part of that ability, sometimes really captures one piece of that ability, and another times it actually almost replicate what we have assessed already. Sometimes it's totally unrelated with the ability that we want to measure, and that is what we call the tragic fall of Mickey Mouse. So, but in order to really understand what is it, why we have these overlapping areas, why we don't have these overlapping areas, so it's important to consider that in the world of assessment, we label that portion of the circle representing the assessment tool an error, measurement error. And the reasons why we have that measurement error are several. One could be related to the type of assessment tool that we are using. Another one could be the learners. Well, we have now millennial learners, and that will make a difference in which they will respond or have answers to an exam. But most importantly, also depends on our raters and our assessors, the person who has the agency and who is conducting the assessment. So it has been explored in different areas of the literature, particularly in one topic that is called rater cognition. So it has been trying to understand what are the cognitive mechanisms that facilitate the creation of assessment and how the assessors or the raters develop those judgments in terms of competence, in terms of entrustment. So what it has been found is that this is by far not a simple linear model, but it's actually multifaceted and multi-axial. So that means that assessment is not only an activity that occurs in vacuum, but is actually embedded in a social milieu in which there is obviously always interaction between assessors and assessees, in which, and it has been an area really interesting of study, that the first impression make quite an impact on how the performance is going to be assessed, and obviously the characteristics of the task and the context in which the assessment takes place. So a question that I have for this model is there any room for emotions in this model? So then, in order to expand this idea, I think it's, again, important to bring some concepts from educational psychology. And there is this conceptualization of assessment that says that the assessment entails three components. The first one is the cognitions, the mental models, the competencies that we want to assess, the observation that relates more to the tasks or the activities that need to be performed in order to conduct our assessment, and the interpretations of the assumptions that are made after the observation regarding competence. So let's use an example of a lab colleague. So in the cognitions, we can have the different technical skills, the knowledge that we consider a learner needs to display in order to, or possess in order to perform this successfully. The observation, is this going to be a direct observation? Is going to be through a simulator, virtual reality? And the interpretation, the assumptions that we can make about the competence of this learner. So what we are proposing is that in this triangle of assessment, we actually consider a tetrad, in which the emotions of the rater really plays an important role in the way in which the assessment is conducted and in which the assessment is also provided to the learners. So, but why emotions? One other aspect of the human reality, because emotions, it has been found in different studies in neuroscience that regardless of the decision that we are making, there is always an area of our brain that is related to emotions that gets activated when we are making this type of decisions. And the evidence that is available in terms of psychology, it has stated that the emotions that we hold really affect the way in which we perceive events, the way in which we solve problems, how we retrieve information from the past, and how we accept and receive feedback. So there are three possible kind of ways in which we can conceptualize the influence of emotion, the rater's emotions on assessment. The first one is if emotions affect assessment, emotions lead to biased decisions making. And that the solution or the consideration for this would be to train the raters. If we assume that emotions add random noise to expand that error term in those assessment bubbles, so we need to add more raters in order to decrease the influence of this error term. But the position that I actually kind of support is that emotion represent a really important and legitimate source of information that contributes to our assessment decisions, leading to fostering our raters and our supervisors to monitoring their own emotions and also to regulate those emotions. So I'm not going to spend time in terms of developing what an entrustable professional activity is, but I think that EPAs are here and are here to stay. And in the same way, the EPAs are a really important component of what we consider is competency-based medical education. What I want to highlight here is that what makes this entrustable professional activity so appealing for many people is the fact that it includes the E of entrustment. And I want to really deconstruct a little bit the relationship between these two concepts, because at some models we are assuming that entrustment and competence are the same, but I just want to highlight how we can have a different perspective on this. So first of all, as it was explained, the competence, it's defined by an array of abilities that are developed over time, that encompasses knowledge, skills, and attitudes that an individual are expected to retain over time. When we move to the world of entrustment, there is more about, it's a decision to place trust in someone. It involves risk-taking. This is not an activity that is totally disprovided of any sort of risk. There is also an important combination of cognitive and affective aspects, and this speaks of characteristics of relationship established between raters and learners, and is context dependent. In order to really exemplify and to magnify the difference between one and the other, let's imagine that you have a 16-year-old daughter or cousin who just got her driver's license, and she asks you to give her your car to drive. So of course, from a competence perspective, everything is in there. That person took an exam, that person took driver lessons. But when it comes to the entrustment, it is really easy to make that decision. The fact that we have evidence for the competence is also an evidence that we can trust that 16-year-old driver. So, and again, I think that what is important here to consider is that entrustment and competence are providing complementary information about something that is really difficult to define, which is the level of ability of our learners. Just to sum up, I have 4 take-home messages, 2 for the busy surgeons and 2 for the advanced, heartless, bold surgical education and researchers, that is really focusing on the fact that emotions is not just a source of error, but it's actually a good way for us to increase the quality of our assessments, and in order also to produce feedback that is going to be significant for the progression of our learners. So thank you very much.